Welcome back. This segment is sponsored by Metro Health. As women, we know that hormones can affect our health, triggering things like headaches or acne. But did you know hormones can also play a role in bladder issues? And joining us now to talk more about that are Dr. Diane Bigham, urologist, and Dr. Jannah Thompson, a fellowship-trained urogynecologist. Both do procedures at Metro Health. Good morning to both of you.
Good morning, Catherine.
Good to have you here. Okay, so let's talk about this, issue of hormones influencing our bladders. How does that happen?
Well, women don't always know that that's what's going on, but they'll come in complaining of recurrent urinary tract infections, vaginal dryness, urgency, frequency, pressure, feeling like things are falling out. I think I need my bladder tacked up.
Oh.
Those are some of the more common symptoms. I feel like I need to go to the bathroom with a lot of urge, and then when I get there, not much comes out, so they might feel like they're retaining urine.
Yes.
Those are common hormonally linked symptoms.
And the way that the hormones are playing a role in that is that the bladder empties better, it stores better, it senses better when there's hormones around. And just to bring back to the symptoms, a lot of times we think about hormones as postmenopausal women, but actually we see a lot of young women who are on birth control who have symptoms related to changes that the birth control
or hormonal changes right after having babies, or just perimenopause.
Yeah.
So those changes.
So these are, in other words, these kinds of issues can crop up at any time.
At any age.
When our hormones are being fritzed with, either by nature or by adjustments
so we
that
see
we're
it
making.
from everywhere from young gals with pelvic pain all the way up to women in their 90s.
Okay, so it must be fairly common then when you say that the age range is everywhere, right? It's a common problem?
Yeah, it is a common problem. I mean, especially, urinary tract infections, that's probably one that people are familiar with, but definitely overactive bladder where you feel like you have to go frequently. There's this constant urge to go, and even some women have leak urine with that, and that's really quite common, like 33 million.
So how do you know, though, that it is hormonal as opposed to some kind of a problem with the bladder or, with the mechanisms, How do you hone in on that?
Sure, again, the patient isn't going to know, but we that's what, taking the history is, finding out what their medications are, other problems they have. Sometimes they're on a hormone, they're on hormone replacement, but it's not the right form. So, for instance, you could be on an oral estrogen, but you're still having dryness and bladder symptoms. So then you got to switch it to a vaginal hormone delivery. So sometimes it's just that you're on the wrong type of hormone for your symptoms.
Okay, taking that whole history and then the exam and putting it together. Yeah.
What about the repairing of the problem then? Is it tinkering?
Some of it's tinkering. Some of it's patching. Some of it's I can't stop
adding.
I can't stop my birth control, but I want the problem fixed. So then we add on top and kind of bandage. Other times it's totally changing around their hormones or adding a new hormone, and it's not always hormone replacement. And some women can have hormones because of other cancers and things, and so we will steer away from that as well and give them alternatives. So.
And we work with their oncologists, at times to make sure that they're comfortable with whatever changes that we're recommending.
The bottom line is it's not something that women have to suffer with. They might think, oh, you use a pad or you whatever to try to just cope with it. It doesn't have to just be coped with.
I think that's really important, that this is not a normal process of aging. This isn't just something that you have to deal with. I mean, yes, women, more women experience leakage and urgency when they're older, but this really crosses all ages, and the more that we talk about it to each other and our friends and our mothers and grandmothers, the more we realize this is really quite common.
All right. Well, if you'd like to learn more about it, Dr. Bigham and Dr. Thompson will be giving a free seminar on the topic next week at the Metro Health Conference Center next to the hospital. It's on Thursday, March 26th at 6:30 p.m. You can get all of the details and register for it at metrohealth.net. Just click on classes and events. You can also find this information on our website at WZZM13.com under Take 5. Your chance to ask questions about it, though. Thank you for being here.